Hi friends, Namaste. Today we've got an interesting session, I hope so. So both Dr. Madhu and Dr. Priya have compiled a list of questions that have come over to us over, I would think, a few months. Interesting questions asked by viewers or subscribers or patients or whatsoever. They're going to go through them. Some of them are really hilarious and some of them are, well, you will see what type of questions we do get asked often, and I'm trying to answer a few of them at least, or maybe answer all of them.
So doctor, I'll start with the first question, and this is one of the funny frequently asked ones. So patient says I've undergone a jaw surgery and I have a lot of titanium implants. At the airport, will I be labelled as a terrorist if the security guy notices that and the machine beeps while I'm passing across?
Yeah, so this used to be an issue, I think, years before. I've had a patient who was caught at the airport almost 2 decades ago while she was traveling abroad, and then we had to clarify that was all surgery, with a lot of implants in the jaws, and therefore that was the reason why the machine went BB. But today I think it's not a concern. These plates and screws, by the way, are very small, they're very tiny, they're well hidden, and they usually don't cause any kind of concerns like this. So you guys really don't have to be worried with any unnecessary attention being drawn on you at the airport by the security guys just because you had some jaw surgeries.
Okay. So she shoots the second question.
So the second question is, in the YouTube videos that we keep shooting or the Instagram posts, we get a common comment, are these patients alive?
Oh yeah. So you have to understand, subscribers and viewers, that some of our videos are being shown when the patient is under general anesthesia. So obviously, they look like dead. They aren't, So this is, I know this is something that they keep asking us, but do remember, our patients are all alive. They're undergoing a surgery with general anesthesia and hence they're so.
So the next question is pertaining to rhinoplasty. This patient says that he's into bodybuilding. So will the shape of his chest change post a rib harvest?
Well, not really. See, because we're going to take a small part of rib. It's a teeny bit and it's taken in such a way that nothing is going to change with your rib shape. In fact, I tell them the only thing that they really will get is a small scar that probably will be a line that's 1 millimeter thick and 1 inch long for guys, and probably nothing visible for women. So that's the reality. I was telling you, I don't know, there was a patient, I read this on the internet, who was asking if he can wear bulletproof vests after some surgery. Just a ridiculous question. I think really no problem after rib harvest, yeah.
Okay, so the next question is on jaw surgery. So patients often ask why, if they have a swelling on the left side of the face, so will the swelling reduce if they sleep on that side?
Yeah, they want a solution apart from surgery. And I think I say this to patients often, that surgery is a last resort. So if you cannot get it solved with medicines, if you cannot get it solved with some other form of exercise or yoga, and then come to us, because then we'll use a knife and try to fix it for you. So a facial asymmetry or a facial deformity is something that happens because of growth. It's usually bony or part of bone and muscle and everything. Very, very, very rarely, I would not say 100%, but hardly ever, these things can be changed by change in your sleeping position or which side of the day you wake up or which side you put your leg first off the bed and all of that. So I think it doesn't matter. So, sometimes, surgery is the only resort. And if it's not, if you have another option, of course, we're going to be the first ones to let you know that as well. What else do we have?
Doctor, here comes the question where patient says, often, can I look like my favorite Bollywood or Hollywood
Correct.
celebrity?
This is really true. So we are getting more and more patients. I think every plastic surgeon across the world, many surgeons even in India, I'm sure are getting this kind of questions because they come with the nose and they say, Doctor Saab, ye naak mere ko lag jayega. Aisa bana paoge aap? Ya aisa ho jayega? Mujhe Shah Rukh ka naak chahiye. Mujhe Salman ka jabda chahiye. All these kind of things. And this is hard. Ye mushkil hai because you are trying to just upgrade your face, है ना? We are not trying to make you into another person's face. We are not doing that. I remember a very interesting case as we're discussing this, So there was this patient who wanted to have his wife's face changed completely so that his parents wouldn't recognize her. Yeah. And they came from the north and they're like, Doctor Saab, problem हमारी ऐसी है कि मेरे पिताजी माताजी जानते हैं मेरी गर्लफ्रेंड है, अब मुझे शादी करनी है तो इससे शादी मना कर देते हैं ये लोग, तो मेरे को उनका फेस पूरी तरह से बदलना है, so that there is no identity. अरे ये भी कोई रिक्वेस्ट है, तो ऐसे रिक्वेस्ट हम मानेंगे नहीं. शायद हो सकता है आंख चेंज कर सकते हैं, आई चेंज कर सकते हैं, सब कुछ चेंज कर सकते हैं अगर आपकी रिक्वेस्ट, इफ यू हैव अ रिक्वेस्ट लाइक दिस, एंड अनफॉर्चुनेटली वी आर नॉट गोइंग टू टेक केयर ऑफ दैट काइंड ऑफ अ रिक्वेस्ट. But if you look at spy movies and if you look at some of the actors, even I have done this for a few people in the movie world, small time TV serials and others, where we put temporary implants and take them off after a few months. But you still would not want to change your face totally for your spouse so that your parents don't recognize her. Yeah, but this is an actual one. And this thing you're telling about noses is very true. So many patients keep asking us to give them noses like X or Y or Z. And the reality is, we tell them as much as we can that look, we're going to make your nose that much more better. We're going to make your face look a little bit more improved. A better version of your face, that's it. Like an iPhone 13 to iPhone 14 type, not 5 to 13 also. So this is the general thing. Yes, we do have huge improvements in certain patients and we are able to do face makeovers. All of that is there on one side, but also you've got to remember that these are not something you would want to do like just go down to a Levi's store and get yourself a jean, like a new face now for this weekend. So some of the youngsters actually think surgery is like no big deal, you just walk in. It's like a service provider. So do you service our lips? Someone asked you this today, right? Today they asked you on YouTube, I remember this. So do you service our lips? No, come on. This is a little bit more than that, guys, because this is surgery. This is a teamwork. It requires high expertise. It's not something you want to just do it. It's not like servicing your phone or television, because it's better if you don't do it at all. So that's why it's slightly different. So I think I explained this point about the nose. Yeah, very oftenly asked. And I have to tell you, I turned down some patients, especially those that are really adamant that they want a particular type of nose. Because I know at the very end, no matter what I do, no matter what improvement we get for these patients, they're going to go back and say, oh, नहीं डॉक्टर साहब आपने अच्छा नहीं कराया हमें, थोड़ा यहाँ पे प्रॉब्लम है, ये है वो है, नाक बिल्कुल ऐसे नहीं है और क्या. So these questions actually help us identify those patients that we possibly don't want to, operate or don't want to do something for the benefit of both of us concerned, for everyone's benefit actually. Right, what else do we have?
So the next question is quite interesting and very common. Do you use plastic during plastic surgery?
Yeah, correct. So, well, by training I'm maxillofacial, but this word plastic surgery is a big hit. Everyone just Googles that, and plastic surgery is a big name today. But guys, plastic is not the plastic that you see. Yes, many people do ask, जो प्लास्टिक से बकेट बनती है वो प्लास्टिक से कुछ काम नहीं करते, लेकिन इसको क्यों प्लास्टिक सर्जरी बोलते हैं? मतलब रीजन इज दिस, प्लास्टिक इन कोट्स इन इंग्लिश मींस मोल्डेबल, जिसको ना हम चेंज कर सकते हैं शेप. तो प्लास्टिक सर्जरी का मतलब ये है कि मतलब नाक का शेप चेंज कराओ, जबड़े का थोड़ा चेंज कराओ, इसको बोलते हैं प्लास्टिक सर्जरी. बट असल में वी आर नॉट यूजिंग प्लास्टिक. Well, having said that, we all use PEEK now, so that's actually some form of plastic, wherein we use material made of various, I don't know what technical term it is of plastic, but the medical grade of PEEKs that can be used for various augmentation procedures that we can put on top of bone to get that look that you want or to correct that deformity that the patient has. So, well, actually, there is a small role of the real plastic too now. तो प्लास्टिक सर्जरी में प्लास्टिक यूज नहीं होती.
So, while the world is going gaga about plump lips and pouty lips, there exists a section of our patients who want thin lips.
Yeah, big section.
Yes.
So I need to get my lips reduced first up. And why I'm saying this is, whole lot of patients, either I don't know if it's because of the wrong advice they get from doctors, or they just think that they need lip reductions. Now the size of the lips is racial, and in India we have the Dravidian race where I live pretty much in the south, also a lot of Aryans, different kinds of racial characteristics. So, imagine you have everything like a Dravidian or a South Indian or an Asian face like me, you're gonna have thin lips. Well, that's ridiculous. And many patients come and ask us, I mean, both Priya and Madhu will know that, and I have to tell them, look, you do not need a lip reduction. You don't have anything wrong with your lips. You actually have nice lips. Go use them. It's something that's happening. Actually, you just had a lip reduction today, and that was a physician. And he had an injury, a trauma that he had several years ago. That had caused the lip to get swollen and was also asymmetric. I was really pouty. Well, then yes, sure, you need lip reduction. But every normal lip doesn't need lip reduction, please. And sometimes you have to know that if you have a very short chin, a chin that's stubby and chin that's inside, you have something that's hanging here with a double chin, which we don't remove again. When you have a lip that's thick, we don't remove the lip. We don't take it off. But instead we work on the chin. So by getting the chin forwards in the right position, by improving this, the muscles around it get stretched, adapts well. You don't need lip reduction no more. So yeah, this is something I think a lot of our viewers, subscribers should know, because they see a video of lip reduction and they say, oh wow, this is a good solution. Yeah, so, right, what else do we have? Are we done?
The next question is more spooky than funny. The question is, can plates and screws cause cancer?
Yeah, no, very genuine concern. I've had physicians who asked this to me years before. And to be very honest, a lot of these fine plates and screws that we use today in maxillofacial or facial plastic surgery, they are not 50 or 80 years old, But some of them are almost 50 years now. But the plates and screw systems that we're using today are not been there for centuries. So really no one knows if this is going to cause cancer, but there's no recorded history wherein a plate or an implant which is used has caused cancer. So all you cancer-phobic guys can go ahead and get your jaw surgeries done. Don't have to worry about cancer for the moment. Cancer is going to take care of itself. And yes, this fear about foreign material in the body, yes, it's very alarmingly high. But don't try to think out of the box. It doesn't become cancer, really, to the best of my knowledge. Not a single literature in so many years of my practice that I've read, and it's not reported, and I don't think it's going to be reported as well. Righto.
So we're done with our list of questions for the day.
Do you have any more? All right, so I hope that was interesting. So yes, this is the funny side of our work. We do get patients that ask sometimes funny, sometimes questions. I also remember this episode where this guy who came with his friends from Hyderabad, I think it was some months ago, and after surgery, he didn't ask me, I think it was the next day, Doc, matlab party kab ho sakta hai? I said, abhi to surgery hui hai. It's not like abhi to party shuru hui hai, abhi to surgery hui hai, so it's going to take some time, okay? Chill, we'll have to wait for a few weeks, then you can do. The next day night, around 1 o'clock, I get a call from the cops. And 3 guys were caught in the beach here, which is not very far from our hospital is. And they were like, these guys are not knowing Tamil. And so the cops were trying to find out what they actually were doing. And the cop also said, one of this guy has a strange needle on his hand. I think they're doing drugs. So I said, no, let them go. They just ran away from my place because this guy's come with his friends and his friends can't stay without partying, so they're just taking him along. So yeah, so this is something interesting, I guess. It was amazing sharing a bit of our interesting experiences that we have from patients and from queries. But if you have serious questions, we'll give you a WhatsApp number. We'll be more than happy to clarify them. Thank you.